Hello everyone, my name is Ankur and welcome to RJPT Simlab simulation. In this video, we will study about the assessing anti-anxiety effects through the elevated plus maze. At the end of this video, we will be able to tell about the anxiety and anti-anxiety drugs effect on the mice with the help of elevated plus maze apparatus. Now, let us start with the video. At first, let us see the introduction part. The introduction says the elevated plus maze EPM test is a widely used behavioral assay for rodents. This is a behavioral test which is used for the assay for the behavioral assay on rodents, and it has been validated to assess the anti-anxiety effects of pharmacological agents and steroid hormones and to define brain regions and mechanisms underlying anxiety-related behavior. The above line says that it is used to assess the anti-anxiety effects of pharmacological agents, which means it is used for the study of the anti-anxiety drugs and its effects, anti-anxiety effects of steroid and also for steroid hormones. And it also defines the brain regions and mechanisms underlying anxiety-related behavior. As we know that the brain is the part which is related or which is related for the anxiety-related behaviors in the of the body. The test involves a plus-shaped maze with two open and two enclosed arms. The model relies on the rodent's tendency to hide in enclosed spaces. The above line says this instrument, the plus-shaped maze, contains of two four arms basically, and which are two are open arms and two are enclosed arms. And the model relies on the rodent's tendency to hide in enclosed spaces. As we know that rodents are used to hide or they like to hide in enclosed spaces or dark spaces. As we know, they hide in holes and spaces between the any objects, and it is a dark and enclosed space. So they have a tendency to hide in such places. So we use this tendency and we understand the anxiety effects, and then we address them with drugs, anti-anxiety drugs, and address the effects of anti-anxiety drugs. At first, let me show you how does an plus maze looks like. This is the diagram of an elevated plus maze. As we can see here, it contains four arms. These are the two open arms, as we can see on the right image, and these are the two enclosed arms. It is closed. It has walls on both the sides, on the three sides. As we can see here, as on the left image, our mice is placed in the between portion, and it can move on the open arms and in the closed arms. As we can see, it is a table-like structure which contains four legs, and over that it has four arms. Each arm is of equal lengths and equal heights. The open ones and the closed ones also. Okay. So now let us see the equipments required for this experiment. The equipments required, at first we have the apparatus. We need elevated maze, syringe and mice cage. We know the elevated maze, the plus maze, the syringe for the administration of the drug, and a mice cage. Subject mice. We require mice which should be of 25 to 30 grams. And drugs. We need an anti-anxiety drug which should be of 0.2 milligram per milliliter. And in this experiment, we are using diazepam. Diazepam is an anti-anxiety drug and which is used for its sedation effect, muscle relaxant effect, and anticonvulsant properties. Now, let us see the principal part. The principle of this experiment says the elevated plus maze test is based on rodents' proclivity towards dark and closed spaces and an unconditioned fear of heights, open spaces, avoidance. So basically, this elevated plus maze test is based on rodents. Rodents' proclivity towards stars. Proclivity towards means tendency to choose or do something regularly. So, as we know that the rodents like to live in a dark and enclosed spaces. So living in in such places is their rodents' proclivity, or whatever they choose or do regularly. So they like to live in a dark place in closed spaces, and in a, and with this we can learn about their unconditioned fear of heights and open spaces also. So the test measures anxiety reduction by an increase in the amount of time spent in the open arms. So the enclosed arms will make them feel like it's an enclosed and dark place, and the open arms will make them feel that it is an open area and it's not enclosed and it's in a height. So amount spent, so that will create an anxiety level in them. So if we are introducing anti-anxiety drugs, so they will have less anxiety, and they can spend more time on the open arms. So we can measure that and that anxiety reduction by an increase in the amount spent in the open arms. So anxiolytic drugs that increases the GABAergic transmissions are reliably effective in this model. So when we observe these, we can observe the effect of the anxiolytic drugs. What are anxiolytic drugs? Anxiolytic drugs are the medications that reduces the anxiety and have a calming effect, and often by increasing the activity of neurotransmitter GABA. GABA stands for gamma aminobutyric acid, and it is situated in the brain. This is a neurotransmitter situated in the brain. So it reduces that. Anxiolytic drugs reduces the anxiety levels and calms the body. So anxiolytic drugs increases the GABAergic transmission. GABAergic transmission is a neural pathway that uses the inhibited neurotransmitter GABA to regulate neuron activity. So what does this mean? That GABAergic pathway is a neurons pathway, which is used for the inhibitory neurotransmitter, inhibitory neurotransmitter, GABA neurotransmitter, to regulate the neuron activity. It reduces the neuron activity, anxiolytic drugs. That's why the anxiety is decreased and are reliably effective in this model. A variety of internal factors and procedural variables can influence elevated plasma's behavior. Now let us see the procedure part. The first procedure part says that assign each animal a number and record their weights. Then separate them into two distinct groups, each containing six animals. One group will serve as control group while the other will undergo treatment with the drugs. So the first procedure part says that we have to assign each animal a number and record their weight at first. Then we have to separate them into two groups. We have to make two groups, each containing six animals, and one group will be known as control group, and the other will go with the treatment of the drug, will be known as drug group. Then we have to choose a syringe and fill it with the zero point 0.3 ml of anti-anxiety medication. We are using diazepam. Then we have to select a mouse from the cage labeled normal, administer the drug to the chosen mouse, and then transfer it to an empty cage. All mice should originate from the normal cage after use. Dispose of the syringe in the dustbin. Do it for all six mice. So the second line of the procedure part says that we have to fill a syringe with the anti-anxiety drug, and then we have to select each mouse's labeled from the normal, and we have to administer the drug and transfer them to an empty cage. Then all the six meshes should originate from the normal cage, and after use, we have to dispose each syringes, and we have to perform for each mice the all six mices. Then the third step says remove the empty mice cage from the table, then position each animal in the maze center and with their head directed towards the open arms. Begin timing with the stopwatch and record the following details. At first, we have to count the entries into both the open arms and closed arms. An entry is counted with all the four paws of the animals are inside the arms. Then the second, the duration spent in both open and closed arms. The first point said that you have to count the entries in the both open and enclosed arms. How much the mouse or mice travels in the open arms and in closed arms, and each entry is counted for all the pores inside the arms. Then the second part says we have to count the duration that the mice spends in each arms, closed and open arms. Then we have to see all the observations for all the 12 mice and in the observation table. Now let us perform this experiment, and for that we are using our RJPT Informatics Simulatory Laboratory. This is the UI interface of our simulatory laboratory. On the left side of the toolbar, we can see the cage, the mouse cage. On the right side of the toolbar, we can see a syringe which is pre-filled with our anti-anxiety drug diazepam, and up and the instrument that we are using, the elevated plus maze. On the bottom side, we can see the instruction part or the procedure part through which we will perform our experiment. On the left side, we can see a table. The table which shows the current mice entry. The column says arms, total number of entries, and average time spent. So we have the column of open arms and closed arms. So the total number of entries in open arms and closed arms and average time spent on open arms and closed arms. And then on the right side of the instruction part, we can see the next and skip button. And on the top side, we can see an observation table drop down. And we will click it. We will see the observation table for each mice. The 1, 2, 3, 4, 5, and 6 mice. We are using 6 mice for the control group. And when we will click the drug treated group, the table of the drug treated mice will over here for each 6 mice, which contains the same table that we have seen over here. Current mice, the arms, open arms and closed arms, total number of entries and average spent time. So we will move it upward and we will start with the experiment. Before that, we can see that we can hide these sidebars also and show also by clicking this hide and show button. Now let us perform this experiment. For that, we will follow the instructions that are provided below the screen. At first, we have to place the cage. So we'll click the cage, and as we can see here, the 4 cages are placed, 2 empty cages and 2 cages, one which is control group and second which is of the drug treated group. And now the instruction says now place the drugs with the trash bin on the lab. So we will click on the syringe button and the drugs are placed over here. And now we will administer the drugs to the mouse and then transfer it to an empty box. By clicking this click to inject button, we will pick mice and administer our anti-anxiety drug diazepam through the intraperitoneal route to the mice and place them to the drug treated group, to the drug treated cage. We'll administer these drugs to 6 mice. So, drug treated cage contains 6 mice with the drugs, and the control group contains 6 mice without the drug. As we can see here, we have to carefully perform this part of the experiment so that carefully we have to administer the drug through the intraperitoneal route to the mouse. We have to not damage any internal organ of the mouse, otherwise it will cause internal bleeding and the mouse can die and it will fail our experiment. Now, after administering our diazepam drug, we will wait for 30 minutes to take the effect. As we can see here, the reverse countdown has been started for the effect of the diazepam. We will skip this part by clicking the skip button, and now we will place the elevated maze in the lab. We'll click on the maze button, and as we can see here, our elevated plus maze has been placed here, which contains 2 open arms, upward and downward, and 2 enclosed arms on the left and the right side. We will hide these sidebars because we have used them. And now we will move on to the next step. Now take any mice and put in the elevated maze for the reading. We have to click. We can click on any mice and we can place it on the elevated plus maze. For an ideal experiment procedure, we will click for the control group and we will observe all the control group animals first, so that after that we will perform for the drug treated mice and we can compare the results with the control group. We'll click with the first mice of the control group and we will place it in the elevated plus maze. We will place the mice in while facing the open arms so that they can have an induced anxiety by seeing the open arms, and then we will observe it. So as we can see here, the mice moves in the enclosed arms because the rodents have a tendency to move to a dark and enclosed places. As we can see, it is moving from one enclosed arm to the next enclosed arm, and it's not moving towards the open arms. As we can see the movement of the mice over here. As we can see now, after feeling comfortable, the mice moves towards the open arms after a few time. So now we will remove our mouse and we will place it to a cage. We have taken 2 cages for the 2 empty cages for the mouses, one where we will keep our control groups mouses and mice, and one where we will keep our drug treated mice. And now we will take any mice and put it in the elevated maze again for the second control group mice. But first let us see the observation table. As we can see here, the time has been recorded over here for the first mice. The total entries of the mice in the open arms has been for 5 times, and the average time spent is 6.8 seconds. And the total number of entries in the closed arms was about 7 times, and the average time spent has been over there for 12 seconds. Now, similarly, we'll perform for the second mice. Now, we'll place the second mice to the elevated plus mice and observe the movement of the mice. As we can see, it moves towards the enclosed arms, and it's not moving towards the open arms because it causes an anxiety level after seeing an open space and a level of height. So it remains in the enclosed and dark place. As we can see here, it struggles to move towards the open arms. It again moves towards the enclosed arms. After feeling comfortable for a few minutes, the mice moves towards the open arms and turns back very instantly and moves towards the enclosed arms. As we can see here, it moves towards the open arms because it has started feeling comfortable over there after a few minutes. Now we will remove our mice and place it to the empty cage. Now similarly we will perform for all the 6 mices. If we want, we can click the next button also. So it will randomly select any mice of the control group and place it to the elevated maze. As we can see here, when we place the mice towards the open arm, facing the open arm, it does not move towards the open arm because it creates an anxiety level in the mices, and because of the height also. So it moves towards the enclosed arm, and it also fills them like a dark place. As we can see the movement of the mice in the enclosed arms, it likes to stay inside the enclosed arms. It struggles, it watches very carefully towards the open arms and but does not move towards the open arms. But after adjusting for a few minutes, as we can see, it is observing very keenly, and now it moves towards the open arms because it has started to feel comfortable around that. As we can see, it has started to move towards the open arms. On the observation table, we can see the entry of the second mice has been placed of the controlled mice group, and now we will remove it from the plus mice and place it towards the empty cage. As we can see, by clicking the skip button, we can skip the whole part. So when we have to perform similar step for each mice, so we'll skip this portion and move towards the next part. You will skip it. As we can see, we are performing for each mice of the control group. We can skip this part. And now we will put the drug treated group mices. So we will place the first mice to the elevated plus mice, and we will observe the movement of the mice. As we can see here, we have introduced the diazepam drug, which is an anti-anxiety drug. So even after facing the mice towards the open arms, it moves towards the open arms because it does not feel any kind of anxiety. It's just because of the diazepam drug. As we can see, it moves towards the anti-anxiety, towards the open arms first. It moves very freely into the open arms, but after some time, it moves towards the closed arms. As we can see, the movement of the mice into the closed arms again after a few minutes, when the effect of the diazepam is reduced, it will again feel anxiety and move towards the enclosed arms. As we can see, it is in the open arms, and by again we will keep this drug treated mice into a separate case so that we can differentiate them. Okay, similarly, we'll perform it for the next mice of the drug treated group. We will see the observation table of the drug treated mice. The first one has shown this much, the second one has shown this much time spent and the average entries. Now we will move towards the observation table. We will skip this part also, and we'll move towards the next step of the observation table. We can see the number of mice that we have used and its timing, the total entries into the open and closed arms, and the average time spent in the open and closed arms. As we can see, a procedural flow button over here. So by this, we can see a flowchart of the procedures that we have performed while performing the experiment. As we can see, even we can slide it down over here, and these are the buttons we can on which we can click and jump towards any step of the experiment. Again, we will move towards the observation table, and we will move to skip this part and move on to the next mice. We can click it, and we will record for the fifth drug treated mice. As we can see over here, the drug treated mice moves towards the open arms because it does not feel any kind of anxiety. Because of the diazepam's anti-anxiety effect and sedation, the mice does not feel any kind of anxiety and it openly moves towards the open arms. It freely moves, but after a few minutes, again it will move towards the enclosed arm when the effect of the drug will be reduced. As we can see, it moves again towards the enclosed arms. We can skip this mice and move on to our last mice. So, when we place it facing towards the open arms, the mice observes very carefully and start moving, and it moves towards the open arms. As we can see, because of the diazepam's anti-anxiety effect, the mice does not feel any kind of anxiety and it really moves towards the open arms. As we can see here, it has shown no fear of the height also and an open space also. But when the effect of the drug will be reduced of the diazepam, again the mice will move towards the enclosed arms. As we can see here, the mice has moved towards the enclosed arms because of the reduced effect of the diazepam. We will skip this part and we will see the observation table over here. As we can see here, at first let us see the controlled mice observation table. The first mice has shown that we have discussed over here. The second mice has shown open arms, total number of entries of 5, and the average time he has spent on open arm is 5.7 seconds. And for the close arm, it has entered it 8 times and average time is 11 seconds. Similarly, for third mice, for open arms, 4 entries and for 6.2 seconds. Then closed arm for 6 times and for 12 seconds. Similarly, for fourth, fifth, and sixth mice. And let us compare it with the drug treated group. The drug treated group has shown that it has that the total for the first mice, the total number of entries in the open arms is for 8 times and average time is 14 times, and the close arm entry is 4 times and average time is 6 seconds. So when we compare it with the first mice of the control group, the average entries of the open arm is less than the close arms. So after treating it with drug, the entry of the open arm is more and the close arm is less. So this means that the drug has shown its effect and it has reduced the anxiety levels of the mice. That's why it has freely moved into the open arms, and number of entries in the open arms is much larger in for each mice, as we can see for second mice also, for third also, for fourth, fifth, and sixth, when we compare it with the control group. So now through this we can understand that the effect of diazepam. Now let us see the discussion and result portion. When we compare the controlled mice and drug treated mice, we have observed that the effect of diazepam has shown that the anxiety levels are decreased in the mice because rodents have a tendency to move towards the dark places and enclosed places. That's why in the controlled mice group, the mice have moved into the closed arms much larger times than the open arms and has stayed there for larger minutes for larger time. But in the drug treated mice where their anxiety levels are decreased, they have spent more much time in the open arms than the closed arms, and the number of entries of the open arms are also much larger. So the result says that the results are typically measured by the percentage of open and close arm time and entries. And increased open arm time and entries are conventionally interpreted as decreased anxiety level behavior. And however, open arm exploration may reflect heightened anxiety and panic-like reaction to a normal situation under certain conditions. So the above line says that increased open arm entries. Time and entries, increased open arm times and entries, as we have seen in drug treated mice, are conventionally interpreted as decreased anxiety like behavior. So, decreased anxiety behavior because of the anti anxiety drug, which we have used as diazepam. So, an open arm exploration may reflect heightened anxiety and panic like reactions to a novel situation under certain conditions. So, for a normal mice on which we have not ins- inserted any drug, they can feel they can show heightened anxiety, which means height anxiety, and can show panic like reactions. Therefore, careful considerations of the test conditions is necessary while when designing experiments and drawing conclusions from the behavioral outcomes in the elevated plus maze test. So, for performing this experiment, we have to carefully perform this experiment. We have to take care of the mice so that they does not fall from the elevated plus maze, and we have to take necessary measures also and preventive measures for the caring of the mice. So now we have come to the end of this experiment, and we have learned that the diazepam has shown anti-anxiety effects and has decreased the anxiety levels of the mice while comparing the drug-treated mice to the controlled mice of moving into the open arms much larger time than the closed arms. Because we know that the mice have a tendency to move towards the closed arms for much larger time. They like to move in the dark and enclosed places, but due to the diazepam anti-anxiety drug, they have shown reduced anxiety levels, and they have moved freely into the open spaces and in the height spaces. So now we have come to an end of this experiment, and we have come to the end of this video. I hope you have learned a lot about the effect of the diazepam anti-anxiety drug on the mice by using the elevated plus maze apparatus. So, guys, thank you guys for watching this video. I hope that you have learned a lot in this experiment. And for more such learning content, subscribe to our YouTube channel, RJPT Informatics. And you can also follow us on our LinkedIn profile, on Instagram, as well as in Facebook. We update and upload our such learning content over these platforms. Thank you.